Good afternoon, everybody. Thank you very much for joining us today. My name's Terry. I am the event team leader or event manager for Renaissance and GL Assessment. We really appreciate you joining us live this afternoon. We will be starting it about 3 o'clock. So I'm just going to go through a couple of housekeeping slides with you while we wait for people to join us. Do tell us in chat where you're joining us from today. Love to hear from you. Do say hello. It'd be great to see where you're joining us from today. So as I mentioned, we will be starting at 3 o'clock. We have just opened the room a bit earlier to give people a chance to join early. You will be muted on arrival, so you will not be able to unmute your mics, but we will be doing some interactivity using Q&A and chat, which I'll touch on in a moment's time. We will be recording this event, and we also will be sharing any presentations or links afterwards, so do look out for that email in the coming days. Any audio issues, you can go to audio settings and have a look at those settings on there if you're struggling hearing or want to test your speaker and your mic. As I mentioned, we will be using a couple of interactive functionalities today, the Q&A bots. I would encourage any question you have in the Q&A bots. Please do make sure you ask any questions in there. We are expecting an extremely high number of people today, so we can filter those questions and they don't get lost in chat. Please use the Q&A bots for any questions. And we will be using the chat function, as I mentioned. Do tell us where you're joining from. It will default to hosts and panelists, but you can change this to everyone. There's a little box that says to, and you can select on the drop-down menu to everyone so everyone can see your message. Do that, please. That would be great. And as I mentioned, we would like any questions in the Q&A. We will try as hard as we can to get through every question. We're likely to be touching on the questions at the end. So do put them through put them on during the session and we'll touch on them as we go along. If you do have any queries after the fact, you can have a look on our website and you also use the email address that I've popped on the screen there. Do save those and do reach out if you do have any queries after today's session. You'll also find on the website the recording of this in the coming days as well. So do take a look at that, but it will be sent to you via email, a link to the recording. And although I can't ask you to do the survey now, it would be great if you could do the survey at the end. It will pop up at the end of this Zoom. We do appreciate any feedback you can give us. It does help us move forward with these sort of webinars in the future, and we do appreciate your feedback. So do take a screenshot of that QR code if you can, but we will be touching on it in the end anyway, so you can do that survey. And just a reminder for those that are still just joining us now, you are going to be muted on arrival, and we will be recording this event and an email will be sent in the coming days. And if you wouldn't mind using the Q&A and chat function, please. Q&A for any questions so we can manage those effectively, and the chat just for anything else like trouble hearing or comments on what's being said. But please do use the Q&A for any questions so we can manage them effectively. And do tell us in the chat where you're joining us from, and do just make sure it does default to hosts and panelists. But if you can change it to everyone can see your messages there. But do just use that. Just tell us where you join us from today. Okay, I am going to stop sharing because we are going to start in a second. We are going to just wait for a few people to join us. As I mentioned, we are expecting a very high number, so we will do our best to answer as many questions as we can today. But if not, we will follow on after today's webinar with all the questions, but we'll try our best to get as many as we can. I can see we're getting through, but lots of people are putting in the chat function where they're joining us from. It's lovely to have you here today. Okay, I think we've now hit the time it's due to start. So I'm now going to hand over to my colleague Rodney, who's going to introduce today's webinar and get ready for today. Over to you, Rodney.
Thanks, Terry. Good afternoon all. Thank you for being here and welcome to today's webinar. I'm Rodney Sakifio, an education consultant here at Renaissance Global, supporting local authorities. I'm also joined by my colleague, Elliot Rintle, who will be managing the questions to our panel at the end of this session. We are delighted today to be joined by Caroline Kelly, Head of Commissioning at Oxfordshire County Council, and her colleague, Jenny Perry, Lead Early Years Advisory Teacher, to share how they are supporting children across 25 primaries and 430 early year settings. Welcome, Caroline and Jenny. Over to you.
Thank you very much, Rodney. I'll just share some slides. I'm so sorry. They are not popping up, which I've just practiced. So that's really good. Let me try again. I'm trying a different way now.
We've got them, Jenny.
That's good news. I'm so pleased. I'm so pleased. Okay, so hi everybody. My name's Jenny Perry and I'm a Lead Early Years Advisory Teacher at Oxfordshire County Council. We're doing a sort of a presentation of two halves today, and that is because there's two sort of ventures in terms of WellComm in Oxfordshire, and I'm talking about where it started chronologically, and then Caroline's going to talk about the learning that we took from that and where we are now. So yes, I am talking about WellComm, and I can see from the chat there's lots of different people here from lots of different services, which is really interesting, and I'm hoping that this will be relevant to you, whichever service you're working in, whether you're working in a school or a setting, whether you're a health visitor or whether you're working in a local authority or in a different role. So I'm talking about WellComm, but actually I'm talking about our beginning, and that was from 2021, and we rolled out the paper toolkit for our early years settings. So that's what I'm going to be talking about. And when you know, I'm sure you know a little bit about WellComm. It is a complete speech and language toolkit from screening to intervention, and it can be used by anybody. And that was what was really attractive to us. It is now available as a digital tool as well, and Caroline will talk more about that. So just thought I'd give you a little bit of information about Oxfordshire. So Oxfordshire actually is ranked as one of the 10th least deprived local authorities, but that slightly masks the pockets of deprivation that we do have in Oxfordshire. It's a very rural county, so we do have pockets of deprivation in some of the main towns, the central Oxford and Banbury, Abingdon, Didcot might be some of the places we might mention there. And our data does show that we have a widening gap between our disadvantaged pupils and their peers. So I think this is a national trend, and it is something that we really see in Oxfordshire. It's something we're working really hard on to support children that start life with at a disadvantage and help them reach their maximum potential. We're quite a big authority in terms of early years settings. These numbers obviously fluctuate, so this is what it is today, but we've got the 419 daycare settings, that includes PVI settings. We also have 381 childminders, 7 maintained nursery schools, and 141 schools with nursery classes. We do have many more schools than that, but these are the settings that I'm talking about that we worked with in the first instance in Oxfordshire. So I'm just going to put WellComm in a wider context for you. So WellComm is a sort of a piece of the jigsaw in Oxfordshire, and it's some of the work that we're doing. So why did we look to improve our early language provision in Oxfordshire? Principally because of the impact of COVID-19 and all of the lockdowns, like everybody else. We have long waiting lists for speech and language therapy, and we felt that because of those waiting lists, there started to be a bit of a disconnect between our early years settings and the speech and language therapy team. Therapists weren't visiting children in settings because they were the children on the waiting list. So we needed some extra support for practitioners in settings. We did set up a strategic early language pathway group, and that's a multi-agency group which includes representation from managers of health visiting, libraries, early years SEND advisory, early years advisory, social care, education, health, voluntary sector. It's a wide group of managers, and lots of this work is comes from that group. We have had some external sort of support and challenge, including a mini peer challenge review from the LGA. And we've worked closely with Public Health, who also attend that group, who've offered us some funding, and we are working with Speech and Language UK to develop our early language digital pathway. I'm very aware that I'm talking to you not at the end of our journey at all, right in the middle of it. So some things we've done, we've got some learning, and we've still got lots to do. We do have strategic connection and support now in Oxfordshire, because we have a new early years strategy and a new early help and prevention strategy, which both prioritise early language and speech and language communication. So that bigger context is just sort of exemplified on this slide, really. So we've done lots of work on stakeholder engagement and making sure that everybody is aware of early language and we're all invested in it. And by when I say everybody, I mean the system in Oxfordshire. And they're the things that we're working on. We're working on workforce development, key messaging, data, and we're creating a digital pathway. So that's the bigger picture. And you'll recognise that triangle on the right. I'm sure lots of people are using a triangle like that, a sort of a graduated response triangle. And some of the things that we're trying to do is really improve the universal provision at the bottom of our triangle through workforce development, and making sure that WellComm is a big player in that universal bracket. So we're trying to screen all children, and that's a really big part of our messaging. We've got our targeted provision, which is some of the children, some of the time, and in our early years settings, we're really helping people see that that is them. Not all children need a referral to speech and language therapy, that actually WellComm gives you the tools you need to be able to meet children's needs who will never need a referral. They just need something extra at a community level. So we're trying to reduce the Q to the top of the triangle, and we're also trying to pull down some of the expertise from the top of the triangle by employing some speech and language therapy advice in our training, etc. So there is a consensus in Oxfordshire that early language development is the key. It's the foundation to which future success is built. And we put this little image in lots of our training so that early years practitioners are really involved in the why of why we're using WellComm and why we've got these other initiatives. The why has been really important in our work. So we purchased the WellComm Speech and Language Toolkit for all nursery settings in Oxfordshire. So that was the nurseries that I mentioned earlier. So it's PVI settings, maintained nursery schools, school nurseries. Childminders has access to a loan scheme, and we tried to make sure there was clear communication to all stakeholders. So the communications and the buy-in, the commitment to WellComm was a really big part of our strategy when we launched. So we had a big focus on the why, and we really did a sort of a drip, drip, drip approach. I don't know if there's anybody from Oxfordshire on the call, but I'm hoping this resonates with you, that we did sort of keep talking about it. So we put little nuggets in our early years newsletters, in our schools news. I was popping up at managers meetings, head teachers meetings, and we've done that across a 3-year period. So we've tried to keep that going. We have developed, we signpost the GL assessment video training, which is fantastic because it can be watched at any time and is really, really clear. We actually also created our own WellComm training, which actually a lot of that was about the why, not just the how of doing it. And so by doing that, we were able to cascade some key messaging from our speech and language therapy service. That's been really successful. So we've trained about about 1,500 practitioners in Oxfordshire now, and that's been had some really good feedback, so that's great. So WellComm is we are ensuring that we've got a multi-agency approach to using WellComm, and that evolves over time. That's not something that you can magic up straight away. I've been connecting with the speech and language therapy team, the health visiting team, social care colleagues, so working with a range of stakeholders to train people up, help people feel confident about supporting WellComm within our system in Oxfordshire. So when I talk to colleagues, I always say, you might not be doing a WellComm, but you might be asking the questions, has this vulnerable child had a WellComm? Who's best placed to do one? So there's a real sort of connectivity between all of the different agencies that are supporting children in their earliest years. Something else that we've done is we've created an early years language lead programme, and that is essentially a lead practitioner in every nursery, or at least that's our aspiration. And that then enables them to come to free training, 6 sessions across an academic year. And people can watch those as a recording. They are jointly presented between early years advisory, early years SEND advisory, and speech and language therapy. And we have people popping up little case studies, trying to exemplify what good practice might look like in relation to early identification, in relation to supporting children with speech, language or communication needs, in relation to communication in friendly environments, quality interactions, books, rhymes and role play, language for self-regulation, for example. They're some of our sessions. And WellComm plays a big part in there. And it was really, really useful to have a key practitioner in every setting that was supporting the rollout of WellComm. And that's had great feedback as well. So I'm just sharing with you now a few comments from early years practitioners in Oxfordshire, and I'll just pull out some of the main themes. So people like the flexibility of WellComm, I think. They like the fact that it's not a fixed intervention that you have to do at a certain time. It's not really labour intensive, it's quite flexible. We know that there's lots of constraints on the early years workforce at the moment, and people like the flexibility of WellComm. And I hope that's something that you found if you're using it in your area. So some people do have little groups, some people sort of sprinkle it across their daily routine. Some practitioners sort of collate common next steps and make sure that key people have got a little laminated tag on their lanyard, so they've got some reminders about children's next steps. And it seems to work best as little and often, and sort of woven through the day and the weeks. Another key point here is that people seem to really like it. So people talk about really enjoying it, finding it really helpful. And although it's taken us a little while to engage all settings, actually when people start using it, they really find the value in it. Practitioners seem to like it that parents are really engaged and find it practical too. So we've had quite a few comments from practitioners saying that they are sharing it with parents and carers at home, and that parents and carers are enjoying it. It is referenced on our local offer now, and so it's sort of it is becoming more embedded. I'm sure there's plenty more we could do as well. Lots and lots of our anecdotal information is showing that children are moving through the sections, that it is having an impact on individual children. People are using it appropriately. So they're using it for children who have a red or an amber outcome. And they are not referring amber children straight away. It's helping settings and practitioners recognise when they can do something to help the child, and then they can see the progress, and it's really heartening. But they're also recognising when perhaps they are putting in the intervention and that it isn't making a difference. That information is then helpful to add to the referral, and speech and language therapists are really pleased to have that information. We are looking generally at our referral process, which at the moment uses other documents, but we are asking people to include their welcome information in their referral, and that's something that's evolving as well. So lots of lovely comments about WellComm having a positive effect on children, and I really like that top left one because all of this has resulted in a really happy, confident child. There's a real recognition that the early years are a key opportunity to intervene in a good way and to support children, and we are seeing lots of nurseries talk about the outcomes that children have made by the time they transition to school, and that's been a real positive. So I was just going to tell you about one setting that I worked with as an advisory teacher. It is located in an area of disadvantage, and they have a really high number of funded 2-year-old children and children with EYPP funding. And they have recently been on a journey of improvement, and if they have improved their Ofsted outcome to good, and that was after they implemented WellComm into their setting. They also did lots of other things in their settings. So they've developed a new curriculum with early language at the centre, and the Senko leads WellComm at that setting. But it's quite a big setting. There's 3 different rooms at the setting, and the way that they decided to do it was to have a WellComm sort of leader in each room, and they attend the training and then cascade that information. They run it so that they screen all of the children in that room rather than key people, but then they share that information with key people in the room so that key people do know their children's next steps. And I went in to do a little bit of moderating over a period of time, and we discovered to start with that although people thought they were doing WellComm, there were some discrepancies between how it was worked out in the rooms and how things were being interpreted. So leadership are now moderating those outcomes, and we're really sort of embedding how it's used so it's really effective. I had a wonderful little moment in a nursery when I saw a little boy that I had seen a year earlier, and I'd recognised him as a little boy in receipt of early years pupil premium funding, and I recognised that his speech and language was at a lower level than I would have expected at that point. I saw him about a year later, and he was chattering away as he was washing his hands using a really high level of vocabulary, and I thought, gosh, that stood out to me. And so I spoke to the manager, and they said, yes, he's one of our WellComm success stories. He's had a screening. His key people have been using the next steps with him. He's been following the big book of ideas, and he's really flourishing now. So that's lovely. So at the moment, we are focusing on re-engagement with settings. So we went big. We went to all of our settings to start with, and you'll hear from Caroline that we've turned that on its head in the next chapter. But for our early years settings, we're sort of making sure that everybody's using WellComm. And for us, data collection has been a challenge because we weren't able to use the data collection tool when we first purchased it. So we were using our own methods to collect that data. And it's actually quite tricky to do that and have really robust data. So if some people put in the first screening but not the second screening, you don't get a full set of robust data. And it's quite difficult to engage people to share their data as well. So that's where we're putting our energy at the moment. Childminders have an opt-in access to the full WellComm Digital tool, and there is a new WellComm offer where we are offering WellComm Digital data collection tool, I should say tool, for all of our settings. So we're working to engage all settings to make sure that they've got that so that we have more robust data sets moving forward. And another thing we're going to be focusing in is sort of going beyond having a tick in the box. So we're moving from that sort of, are you using WellComm, to how well are you using WellComm? So like I just described in that nursery setting where I went in to sort of investigate how well embedded it is, Are our staff using it appropriately? How effective are the interventions? So we're going to be focusing on that through advisory officers, and we've got some language lead champions that are qualified to a level 3 level that are going to go in and support that as well. We've uncovered a few anomalies that are a bit unhelpful, so things that we don't really necessarily have a common language to talk about WellComm outcomes. So some people sometimes talk about a 3, or people are using strange numbers perhaps, or so we want to develop a really common language so people are confident to talk about red, amber and green outcomes at a child's chronological age, and that we're all talking in that language, and we think the data tool will help us to do that. And although we have got a reference to WellComm in our transition documents, we want to really embed that so that schools are asking for WellComm data and settings are really eager to give their WellComm data to schools. Okay, so this is the end of my little bit of the presentation, and in summary, I'm quite proud of the work that we've done in Oxfordshire. I think the Language Lead programme and the wider key messaging about early language being the key to later life success, and the importance of WellComm, the importance of early identification in children's early years, has really helped engage settings. So the fact that we've positioned WellComm within a sort of a wider piece of work that we're doing has been really helpful. All of our anecdotal and case study feedback is really strong. As you can see from those quotes, people are really warm. They feel warm about WellComm, and that is across the board. You know, we've had a lot of comments about that. We've had challenges in terms of our data collection, making sure that that's robust, but from sample data that we have got, we've seen at least a 10% shift from red to amber and amber to green when we've been looking at data sets, and we're looking forward to having more robust data soon. WellComm is becoming further embedded in our system, and I've talked about social care colleagues. I've talked about speech and language therapy referrals. Health visitors are talking about WellComm at 2-year and 4-year checks in Oxfordshire, but there's other work that we can do to further embed that. And as I said, as an advisory team, we're now looking to maximise the effectiveness of WellComm in settings, looking at our common language for it, looking at transition, and looking at really effective intervention. And that is the end of my section.
That's great. Thank you, Jenny. I will happily take over
now.
now.
Caroline, sorry, Caroline. Oh, I'm not even on there. But I'm just going to jump in really quickly. I do apologise. I'm just going to very quickly just ask Terry just to pop a poll on very super quick. All we want to ask just at this stage, and we'll put this back on. I'm really sorry, Caroline. I'm just completely cut you off there. Just really simple. We're going to put this back up on the end as well. It's just at this stage to kind of get an idea if there's anyone on the call who wants anyone from Renaissance GL to make contact with you, particularly from a consultant point of view, to chat with you about WellComm Digital at all. Please mark yes on this. There's nothing else you need to do. Don't worry about putting it in the chat or anything. Just please answer yes on the poll, please. We will put it back up at the end. You don't need to answer it twice. It's just the one with the same poll. So just answer it now or at the end. If you don't want to hear from us, just hit no. If you're happy to have someone get in contact, then please do hit yes on that. We'll give you a few moments and then it'll be back to you, Carol. I do apologise.
Over to you, Caroline.
Right, okay, sorry, I thought there was something else. Okay, hi everyone. I do apologise. I have been losing my voice. I've got the dreaded cold, but I'm going to talk to you about primary school WellComm rollout. Right, okay, so just a bit of an overview as to what we did. So our pilot, we wanted to start small to learn really about what do schools need in terms of the WellComm rollout? So in terms of training support, how are they getting on with it? Is there something we want to invest in across all of our schools? So in Oxfordshire, we've got 272 primary schools, so we've got quite a lot. And I put out a survey just asking primary schools really how many children, or what percentage of children are struggling with their speech, language and communication. And we had a really good response rate. And in that survey, I asked whether they would like to participate in a pilot. I was expecting about 20, and I got 45. So I was really, really happy with that. So we agreed to take all 45 schools into our pilot, which started in March this year. And that is actually funded by our high needs block, which is the part of money in the designated schools grant. Oh, sorry. Okay. So is to fund the program because it's very much an education tool. And I'm really pleased to say that they have screened over 1,000 children so far. That was at the end of September. And they have also given 105 children a second screening following interventions. So the aim was to get primary schools to screen all of their children in year one classrooms, and any new children who were starting school at any age. And if there are any older children who were experiencing any delays or problems with their speech and language communication, so that they could use the tool to help them. But as a whole, to screen all in year one. And they've also been using it for early years age children as well. But that's a choice, not part of the pilot. We required the school to nominate a language lead, which is usually their SENCO or EYSS worker. And they accessed the free online training that GL Assessments provided on the website, which was really helpful for them to get started. And then we also provided more training through our speech and language therapy team and our communication and interaction advisory teacher scheme as well. Next slide, please. Oh, thank you. So I won't go into too much about the graduated response, but we have incorporated that within our graduated response within Oxfordshire. And I think it's really helpful to know that this will really support schools in their new Ofsted inspection framework around inclusivity. So that's something which we are really interested in working with schools who perhaps have had inadequate or requires improvement Ofsted ratings to improve in that area. And this is a major part of our SEND local area inspection improvement program, which we've been working on since our inspection in 2023. I'm really pleased to report that we had a recent monitoring visit with Ofsted and CQC, and they have given a lot of praise to the use of WellComm in primary schools as part of our ability to identify and meet need earlier. And to support children while they're waiting for speech and language therapy. And also there are similarities to ELSEC programs that have been rolled out by the Department for Education. I recently attended the Barnet webinar on their ELSEC program, and they developed a identification and intervention tool similar to WellComm internally. So lots of similarities there. Next slide, please.
I think you have got control, Caroline.
Yeah, oh, yeah, great. Okay, thank you. It wasn't working just a minute ago. So in terms of the tiered support, I won't go through that again, James already covered that. But in terms of those children screened at red, typically they would be the children that would be referred to speech and language therapy. And I was a bit concerned that this might just drive up demand. However, what we have seen is that children screened as red are still making really good progress through the reports. that we're collecting through the digital model using the Big Book of Ideas. So we can really demonstrate that they are receiving help while they wait for speech and language therapy as well, which is really important. It doesn't replace the need for a therapist, but it does support them while they're waiting. So I'll just give you some examples of reports that we receive from the WellComm tool, which are amazing. They are literally generated at a click of a button. I can request them anytime for any period of time, and you can request them for 2 different types. You can request a report for all screenings or all those that have had a follow-up screening, so you can track progress. So these are the reports from all the children who were screened. So this one was done a little bit before the end of September, where we had at the time 964 children screened. And you can see the breakdown between red, amber and green ratings for those children. And I'm not too sure if anyone sees this as a surprise, but actually there was a higher need in boys than there are in girls for Oxfordshire cohorts. This one was really quite interesting. So I don't know if many of you have used the tool yet, but if the child screens green, they are where they should be age-wise, which is great. If they're scored as amber, they are 1 year below. And if they are scored as red, they are 2 or more years below. So in some instances, we were seeing children screening as 5 years below their actual age, which just goes to show the level of need when you're looking at screening primary age children. And we were having children attend school who were non-verbal, who weren't able to communicate. So this tool was essential in helping them make progress, as well as identify their needs as well. This is a report. There's a few different reports, but the top one was around the identification of their needs. And this is selected by teachers themselves. So we are reliant on the teacher knowing what those child's needs are. So hardly surprising that we've got a lot of reds in those screened who have autism, speech, language and communication needs, have SEND but no EHCP yet, have social and mental health. So that was quite interesting. We have a high prevalence of children screened as red who have English as an additional language, which it wasn't too much of a surprise. We want to do some more work to understand whether schools were screening in the child's language or in English, and whether that will make a bit of a difference to those screening scores as well. And also a high prevalence of red and ambers for children on open to receiving pupil premium as well. In terms of the age, so the majority of children were screened were aged 4 and 5. We are seeing a high prevalence of reds in younger and older children. However, I think that's because they were not routinely screened all at that age. It was only those children that were displaying signs of having delays in their speech, language and communication, or having difficulties with them being screened. So that figures that there will be a high prevalence of red and ambers for that cohort. So in terms of progress, this is what you'll see when a child has had a second screening, or they can have more than one follow-up screening. So at the time, there are 102 that had received that second screening following the Big Book of Ideas and their tailored interventions as a result of their initial screening. So it's really, really great to see the reductions in red and amber. So we see reds reducing from 22% to 12%, and amber from 36% to 12%, and increasing in green from 42% to 76%. So that's great quantitative data that we were able to show our school leaders and leaders within the local authority, and also during our recent monitoring visit with Ofsted as well. So in terms of progress, we've seen the most amount of progress in 4 and 5-year-olds. I think the charts show for themselves really how well they've improved following just one area of intervention, which is for 3 months. So we are hoping that continues. So once a child is scored as green, then they don't need any more follow-up work. But if they continue to score red or amber, then they will continue to work on the big book of ideas until they are screened as green. In terms of the training that were rolled out, so far we've rolled out 3 training sessions with, with language leads, and so attendance has been a bit variable, and we wanted to cover subjects that were relevant to children who would be supported through the WellComm tool. So we did a session on communication and friendly environment, another one on vocabulary. The latest one was on emotional regulation, and we've got 3 more planned by Christmas as well. And we've had a really good satisfaction rating of 4.5 out of 5, and we continue to roll those out. But we would like some more language leads to come along, and the idea is that the language leads would then take that material and use that to support teachers and TAs in their school. So a train the trainer type approach for our language leads. And like I said, they are delivered by a speech and language therapist and also our communication and interaction advisory teacher service as well. So I'm just trying to move us on. Doesn't seem to be working. Can you move me on, please, Jenny? Oh,
I think we've lost Jenny, Caroline.
Okay, right.
She's frozen.
Yes. Okay, no problems.
Have
I
you got
will.
the deck or shall I share it?
Yeah, I should be able to share it just for a moment. So hang on.
Sorry about that, everyone. Looks like we've had a technical issue there with. Just give us a couple of minutes while we share this deck. That'd be great.
Okay. You should be able to see it now. Is there?
We can see it. Yeah, Caroline.
Okay. That's great. Okay, perfect. Okay. Right, where was I? So in terms of the, we also did a school survey back in July just to understand, how are schools using the tool, and are there any improvements that we could make to both the support and the tool itself. We had a score 4.5 out of 5, which is great. And here's some really helpful comments back from teachers and TAs. So one of them said that they actually preferred it to Nelly, was much more easier to use, and they liked the traffic light system of red, amber, green, and easy to see the progress for children and for staff to understand what's happening and the impact that they're having. So that's great news. They like the useful ideas, which could be adapted to suit children in their settings. And they were able to see everything that the child has a score on and easy to access to what the next steps are in their WellComm journey, which is great. So, and then we asked if they could rate the overall use of the tool when delivering from the big book of ideas. So again, 4.5 out of 5 on that question. So they were saying that it was really helpful for staff to think of activities to have in terms of continuous provision and practice, as well as the interventions. They like the fact that you could print out the ideas and pass on to other staff to complete the activities. And also they are using it for new children due to arrive in September from the preschool, so that they can understand what their needs are. from when they've been screened in the preschool. We've had another one that says that they love the interventions and can be integrated in the classroom rather than an emphasis being on removing children from the classroom. There is an option of one-to-one small group, and for me, whole class ideas was helpful, as this year the children didn't require one-to-one, but the ideas in the big book really helped me to shine a spotlight on specific skills for all. So that's really great feedback. So in terms of the rollout, thought it'd be helpful to share some lessons learned. So one of the things that we discovered is when we did the survey in July, we noticed that 20 schools actually weren't using the tool out of 45. And the reasons given was that they wanted to start at the start of an academic year. We started ours in March. So if I was to offer any advice, I would offer to start in the autumn term of an academic year, once they've got to know the children a bit more, rather than when we did it for completeness. I've ensure that the language leads fully understand the ask of them. So we had some language leads get confused with the early years rollout, and came back and said, oh, we're not using the digital version yet because we're still using paper. And we had only rolled out paper in early years, so it became apparent that they thought it was for early years, not primary school age children. So just be really clear on the ask and what age children this is for. And also we've had some questions from teachers and TAs that were based on how to use the tool, which had they have completed the online training from geo assessments, it would have been in there, and we could have just directed them back towards that online training. So that's really important that they complete that. And yeah, like I said about the early years and primary age children, just make sure that they understand what age group you're looking to screen, or if you are looking to roll that out for both, that's absolutely fine, because the tool will enable them to select the child's age when they start screening. So it can be used for both early years and primary, that's no problems. We've used the digital version for the primary school, and the reporting methods are amazing. And I know that is an area of improvement. I know Jenny is wanting to make around the early years rollout is the collection of data. Because we've used digital, it's all automated. There is no need to do some additional completing of paperwork. So we were able to capture that quantitative data really, really well. So I would always go for digital. Make sure your head teacher is on board as well. That's really helpful, especially when you've got problems and you might need to just iron this out, or take up issues or non-attendance for training and things like that. And also really helpful to link in with SEND teams, advisory teachers, school improvement, and also the therapy service, who are all working with schools in various different ways, and they can really help you maximize the rollout to make sure you have a successful rollout of WellComm as well. So in terms of the future for us, what we would like to do is analyze our speech and language referral data from schools that are on the pilot to see whether we have seen a reduction in referrals, or referrals being for children who should actually be assessed under our speech and language therapy service. And I say that because 50% of referrals are not triaged to go on to having an assessment. So we have a high number of children who were referred who don't meet the threshold for an assessment. So that's something we want to try and address through the use of WellComm. We want to fully embed it into the ordinary available toolkit that we roll out for schools across Oxfordshire. We would like to do a peer support programme with language leads to schools perhaps that haven't screened as many children or are struggling with the take up of the tool, so that they can learn from other language leads. We would like to roll this out to further primary schools, particularly those who have had poor Ofsted ratings, so either inadequate or requires improvement, or those under school improvement, whose school improvement feel that they need some improvement around phonics. That is definitely an idea that we want to take forward. We would really like it if GL assessments could roll this out for secondary schools as well, because we're seeing a lot of need around speech, language and communication in secondary schools, and also youth justice as well. And that is the end of the presentation from myself. So I'll stop sharing.
So much, Caroline. Right, we are going to do some questions in a moment, but I think Terry is just going to pop up the poll for one last time. Says, there it is. I did say last time it was going to be the same poll. It is actually very slightly different. So there is an added question there, number 2, which links slightly more to Oxfordshire rather than to us. So please do complete the poll. We'll give you a few moments to do that before moving on to the questions for both Caroline and Jenny. I'll just give you a few more moments on that. I think we'll make a start on the questions. So I'll let you two choose who wants to go for it. First one we've got is kind of in 2 parts. So who delivers the screening and intervention? And then is it a training workforce model where the PDIs or settings are supplied with the toolkit and then trained by your team, and the purpose is for them to carry out the screening and intervention?
Yeah, so I can answer that in the first part. So it's a 2-part question, really. So yes, the toolkit is for settings and or schools, and it can be used by anybody, and it is the person working with the child that completes the screening and the intervention. Because we've been rolling it out across Oxford, it can be purchased by any standalone school or setting, but because we're coordinating an approach to this and embedding WellComm into our universal and targeted sort of brackets in Oxfordshire, that's the way that we've rolled it out. So we have directed them to the GL assessment training, but we for the early years rolled out, we also created our own sort of Oxfordshire training, which helped to engage them in the why we were doing it, and we were able to cascade some key messaging from speech and language therapists that we wanted to do as well. But yeah, it is delivered by people working with children in schools and settings.
Thank you, Jerry. Second question. This one is, how do childminders share WellComm in Oxford? So I don't know whether that's specific towards data, or whether that's to do with quite literally the sharing of WellComm in terms of
to
the
start
assessment.
with, to facilitate access for childminders, we had a loan scheme, a very small amount of packs that we supported childminders so that they could access and use it. But we have now got access to the full WellComm Digital tool. So in line with the school's pilot, that's what childminders have access to now.
Perfect, thank you very much. This one is a really good question here. Why did you go, so across your rollout, why did you go for WellComm over other programs?
Yeah, well, I can talk and then Caroline can talk, I think. So we looked at a variety of other options, and we looked at the pluses and minuses, including the cost. We went to lots of webinars and listened to other people talk. And this is the choice that we made. And Caroline, yours was similar?
Yeah, so we did a full options appraisal on all the tools, and including Nelly, Language Link, Speech Link, WellComm, and when we were making our decision, WellComm Digital was just being launched, so we were really keen on WellComm Digital. it was by far the most cost effective out of all the tools that we analysed. And also we wanted to be consistent with early years, who had already rolled out WellComm back in 2020 during COVID times, wasn't it, Jenny? Because it's nice to have that follow through from early years into primary. And also a lot of schools have reception classes, so they don't want to be using two different tools. So yeah, WellComm was a clear choice for us.
Thank you both very much. Well, a couple more still. Let's go with this one. So, with regards then to your SALT service, so do you have any particular criteria, such as all children who score red are referred? And you did touch on this slightly. How many sort of PDRs for amber scores, essentially? So, kind of, what criteria do you use, I suppose, as part of that kind of referral for children?
So I think we said that's becoming more embedded. So at the moment, our advice to practitioners is amber means please enact the big book of ideas and start your interventions and monitor. And red is likely to mean a referral. So please make a referral and still continue with your intervention as well. If you are making a referral and you have used WellComm, we do ask people to include that in their referral. But Caroline, you might want to say more.
Sorry, can I just ask a follow? Is that a referral to speech and language therapy? Yeah.
So yeah, that was. Let me find the question. It's disappeared. It's on a different screen. Hold on. Yeah, in regards to referrals to the SALT service, so speech and language referrals. Essentially, kind of what are the criteria that you have?
I need my speech and language therapist here, really, but they've got a lot of our referrals into speech and language therapy are because of a education healthcare needs assessment. So usually the referral for the education healthcare plan dictates that referral. So it will say that the child is has underdeveloped speech and language communication needs, and if they aren't already open, then that would trigger triage and possible assessment. But what we are seeing is 50% are not meeting that triage to be then offered a full assessment. So we're having to do a lot of work around, well, what typically should be going through to speech and language. And I think that's really where WellComm can be really helpful, because we're saying typically the red screened children would be your speech and language therapy referrals, and amber would be, they can have support in settings, and green are absolutely fine.
Okay, we've got a couple that's still coming in. Let's go with that one. This has come up a couple of times actually. So in terms of timescales between your first screening and then your rescreen for those children.
So we recommend every long term in line with the handbook. So we recommend that we screen all children in the autumn term, and then we rescreen in the spring and the summer.
And in terms of primary age, all children should be screened initially in the autumn term, and it's only those who are red and amber who would continue to be rescreened 3 months apart until they get to green, and then you can stop the interventions and stop screening.
Okay, perfect. Just look, I think we've got one. No, we've got more. Let's go with so I'm just looking up over there. Oh, there we go. So so you mentioned about you also the AL children and about sort of screening in different languages. So did you see any difference in results? I think you said about screening in home language. Was there any sort of change in terms of having children screened in their first language versus in English?
I haven't done any work around that as yet, I'm afraid. So that is something we want to explore from the data that we've seen in the reports. But I don't know, Jenny, do you have any children that have been screened in their native language?
No, we have lots of conversations about children who are learning English as an additional language and whether you can still use WellComm. And all our advice is in line with the handbook. So we say, yes, you can. And the best way is to screen in your home language, and that would be your first choice if you can. Obviously, not everyone can do that, but we're helping people see that you're looking for a difficulty in learning language rather than a child that's very early in their journey of learning English. So all of the advice is within the tool.
Yeah. Still got answers. They keep coming in. It's not going. Right, so we've got one here. Okay, so we've got someone who is implementing a project in their local authority this academic year, and they're really interested in whether you have found between you any change in categories of need across your authority as schools have potentially uncovered unmet language needs when children were previously classed as having an SEMH need. That's quite a long question. I can go once more if you want, and we got it.
So do it again.
Okay, I'll go one more. So this particular person's implementing a project in the LA this academic year. So they're interested in knowing whether you found any change in categories of need, essentially, kind of as you were as people were embedding, as people were using WellComm. Did that uncover any unmet language needs in particular? Where particularly they've stated there, particularly when children were previously classed as having an SEMH need.
Okay, so it's not a piece of analysis we've done at the moment, but I think our overall aim is recognising that early language is the key to later life success, and we recognise that a lot of children are presenting with challenging behaviour when actually it might be an unmet need. So it's definitely a driver for the work that we're doing, but I can't comment more than that really.
And I think the need category, if that's what we're referring to, that comes up in the report, that's very much the teacher selects or the TA selects what category they feel that the child is in at the start of the assessment. So because we can't track individual children, we don't have that level of information because I only see anonymized data. I can't tell whether a child has had their category of need changed as a result of the WellComm interventions. I'm afraid that's not something I will have access to. Yeah.
Thank you. It's a tough question, that one.
Yeah.
Okay, I've got one here. Have you got any plans or ideas for how you're, particularly, you obviously mentioned sort of primary schools and engagement. Have you got any plans and ideas for how you are going to essentially engage more primary schools in getting that and also joining the project?
Yeah, so like I said, I think if we're going to do another rollout, we want to target those schools that need help the most. So working with school improvement colleagues, centre colleagues, advisory teacher colleagues, where they do know of schools that actually do need to improve really, and that can also be upon their Ofsted inspection ratings as well, and their phonics scoring as well. So they're the ones that we potentially want to target the most. We also have some schools who are going to become alternative provision settings and have resource bases in them, specifically around supporting children with speech language communication. So we would also like to offer them the WellComm tool as well, because they will be supporting those children with the highest needs in mainstream education.
Brilliant. Thank you so much. I think we're going to, I've seen Terry appear. I think we're going to call that there. Thank you so much for your questions for everyone. If we didn't answer any questions, what we'll try and do is we'll try and pick up on those afterwards when we follow up. Thank you.
No problems.
Thank you, everyone. Thank you, Caroline. Thank you, Jenny, for a great session and informative on WellComm. Thank you, Elliot, for asking questions. We didn't get through every question, I'm afraid. We haven't reached the time, but any questions we didn't get to, we will come back to you following. We've got a note of all the questions, so we can come back to you with any questions you might have had. Thank you, everyone that did the poll. We will be in touch as well, or a colleague will be in touch if anyone wants more information information on WellComm or the Oxfordshire initiative, so we will be in touch with that. There is an email that will go out in the coming days with the recording, the presentation that's been shared today, so do take a look. And as I mentioned already, and I did put it in the chat, but it will appear once you close this session today, is a survey link. If you wouldn't mind just taking a couple of minutes, just a few questions, just to give us some feedback, we'd really appreciate it. It's what we use to kind of move forward with these sessions, and we'd love to know what you'd like to hear in future. Again, I want to take this opportunity to thank my colleagues, Rodney, Elliot, the people behind the scenes today, Sheena, Verony, but mainly our special guests today, Caroline and Jenny. If you have no further questions and nothing else to add, please do. You can leave the session by pressing leave at the bottom, or you can press the X at the top. But thank you so much for coming today, and we appreciate you taking the time out of your day to join us live. Take care, everybody. Have a good evening, afternoon. Take care.